regarding the upper limb, a shoulder is and the arm in supine position is remaining. So that we'll cover in few presentation slides and video again. So for supine position, we have to really make sure that our drape is gone under the scapular blade. So many times we put some support under the scapula, either roll sheet or hard material or a water bottle, so that the shoulder comes up. So that gives a bit of few inches of space from the table, and this actually helps you to make sure your drape goes under the body or up to the scapular edge, making sure that there is no contamination happening from that side. So the rest of the body is to be covered. But as we spoke about groin area, the critical area in upper limb and shoulder is basically axilla. So we really want to make sure that the axillary portion doesn't get exposed during the operative work. So plastic sheet which is used initially, we take a Alice or a swab holder and making sure that it is pushed underneath the body, taking another drape from the top, a plastic drape. So two plastic drape usually help you to cover the entire body. Because of the gravity, your fluids are going to leak or go down towards the table and under the body. So you have to really make sure you are keeping it dry and there is a bit of sterile cloth cover between the surface of the table and a posterior part of the shoulder. So this really would help in isolating the shoulder area. The second drape comes in from the top. It is curved around the shoulder and then it is secured to the initial cloth drape that we are used. One should make sure that it is not tightly bound, leaving an adequate gap onto the anterior shoulder surface for your extension of the shoulder incision if it is required in depending on the surgical scenario. Once you have left an adequate cloth to cover and make it lax, you can isolate that area using extra drape coming from that side and getting secured to your drape which is covering the anterior axilla. Making sure that this drape also covers the opposite arm is important, so that whenever the C-arm is coming from that side, there is no unsterile surface coming in contact. The lower limbs or the legs are and the rest of the body is covered, and arm and the forearm is covered depending on your extension of the incision. If you want to leave the elbow free, then only use the forearm and wrist and hand in the drape and secure it with the bandage. By doing this, you are making sure that axilla and the space between the fingers, which are likely to be a contaminated area, are not being exposed. Now the final drape comes for a curtain across the anesthesia site and covering the tube or head end of the patient. Thank you. So I'll hand over to Dr. Khadilkar now. So we'll be covering the spine area draping now.
Yeah.